Alright, we're going to get started today. First off, we're going to do our adjustments for the group vignette. So I'm going to start out with the L2 left rotation restriction side posture push. So if it's a left rotation restriction, it's a right rotation fixation. So then I'd want my patient, this is my patient, left side down, right side up. L2, we're going to bring him, we're going to roll him home, and then we're going to push. And it's going to go P to A, I to S, and L to M. So that is the side posture push. Oliver, get out of here. Go away. For the prone drop, it doesn't matter which side that I am on. I'm going to do a reinforced pisiform. I just want to make sure that my hand is going kind of up the hill. So I'm going to use this hand right here. We're going to lean into it. We're going to push it straight P to A. And if I had a drop tape on this, I would set the drop down. And then we do that probably about 3 times or until we felt the restriction was eliminated. So next I'm going to demonstrate how I would properly clean the table. So after my patient, or before my patient was on there, I would wipe down the whole entire table with a disinfectant wipe. I would especially focus on the headpiece where they're going to lay their head face down on. I would make sure I wipe down the bar in the middle, change my paper completely. I want to wipe down any area they touched their hands on or their face on. I would also wipe down the room in which they walked in. So I wipe down like the doorknobs and stuff like that. I will wipe all that down as my proper cleaning. The next thing I'm going to do is demonstrate exercises. So for this group vignette, the patient had a potential problem that we would refer out, but if we didn't refer out, then I would focus on the patient's pelvic strength as well as their core and mobility. So for pelvic strength, I would start out with this patient with just a simple clamshell exercise. We'd probably just have him lay on his side and we'd just go like this, and we'd do it 3 sets of 10, 2 sets of 10, depending on patient tolerance, and then we'd go this way. And that's just, we would start to get that glute med, glute max, piriformis, get all those muscles fired up and get that pelvis stronger. Also with this patient, I want to focus on some core stability and some core strengthening, as well as kind of low back strengthening since he likes to walk his dog and want to walk around. So I would probably start out with him regressions of bird dogs, and I would just have him go one arm up and then the opposite leg, and I'd have extend him all the way, really focusing on keeping that core strong and stable. If he was able to maintain it, I would have him do both arms, but again, it'd be dependent upon his balance and strength. So after I treated this patient, I would expect his lumbar spine mobility to increase. He's had good care with, or good results with chiropractic care, so I would expect his pain to go down a little bit. If it wasn't for those complicating factors, I think he has some sort of either SI or facet joint restriction that we could definitely take care of. Like I said, after I treated him, I would expect his pain levels to go down. I would expect his muscles to kind of calm down. The biggest thing for after treatment is I would want to make sure he understands the importance of continuing chiropractic care, so that way he's not in these acute flare-ups of pain and he can do things like he likes, like walk his dog and go to church and all that stuff. Alrighty, thank you.